We added to that is the 20 city hospitals that we have built in the last 5 years. That is a large collection of hospitals, campuses of hospitals, say cardiology, oncology, maternity, a general hospital, orthopedic hospital, under one campus.
Yeah, it's like medical city.
It's a medical city.
Yeah.
It's a medical
It's a
city.
mega medical city.
Yes, we call it city hospital, but it's a medical city.
Yeah. Your Excellency, Mr. Saleh, Ambassador of Turkey to Egypt, it's a great honor to welcome you today in our annual health reform of Egypt healthcare reform, and we'd like to thank you for accepting our invitation, for being here today, and for being with us in EHA Podcast.
Thank you very much for inviting me. It's a great pleasure to be here with the Egypt Healthcare Authority. I appreciate your efforts and the great progress that you have made as Egypt Healthcare Authority. I think that you have made a great transformation in Egypt already, and then the way ahead is already very clear for Egypt.
So, Your Excellency, we began our healthcare reform since 6 years ago, and this is our annual ceremony for this inauguration. So, how do you see the reform in Egypt, and how do you see the areas of cooperation between Egypt and Turkey in the area of healthcare and the health services?
I have heard so much about the universal health insurance campaign and the progress that has been made by under Egypt Healthcare Authority. I know that 7 governorates already are covered by Egypt.
6 governorates, and we are going to extra 5.
Okay, today in the lobby I was discussing and I was told that it's already 7, but I understand already 6 out of 26 governorates.
Yes.
This is already a good model and a good coverage. Of course, I do understand that it has to be also electronically integrated as hospital system with the centralized system of universal health insurance with the national ID system. This is part and parcel of the system. So the approach is novel and extremely important that you go step by step. And this is the Egyptian practice and model. And it is working with international partners such as Japanese authorities, JICA. And I'm sure you're working closely with the World Bank, WHO, and European Union and other international partners. Egypt's population is huge and growing annually. So for any country, it's a challenge to have the whole population under comprehensive system covered. This is what you are trying to do. And I think that given the cost of health services in terms of doctors, nurses, public utilities, infrastructure costs, it looks to me it is very doable because the cost of health services, as far as I could tell, in Egypt is lower as compared to America, Europe, Turkey, and the Gulf, especially the Gulf countries. So this can be considered as an advantage going forward. So therefore, it is a big undertaking, but the system is already there, and then you have already covered a large section, 25% of the whole of Egyptian governorate. So therefore, I see it as a clear path ahead for you. It's just a matter of time and preparing the infrastructure and the superstructure, meaning all the electronic and computer integration with the citizens and the service beneficiaries. I see one challenge that's extremely important to me because you need these service beneficiaries to be able to adopt and then use the services efficiently, meaning the patients must be able to access the system in a way that you envisage, that requires a certain level of practice and information and the preparation of the patients. So you have every patients from every background.
Yes.
So that is an important social challenge indeed, but it will also be overcome, I'm pretty sure. As Turkey, we have achieved more than 99% of coverage of our population.
It's a big coverage. It's
Yes,
good-
almost
good we
complete.
get. Yeah. Also,
So-
to cover most of
Almost
Turkish
complete,
people. Yeah.
over 99%. But of course, as opposed to Egypt, we have different kind of population crisis, meaning our population is not replacing itself at the same level as we lose the population. So our productivity rate is 1.4. It normally has to be 2.1 to the replacement level. So therefore, we don't have a social challenge. We have almost achieved the full coverage, and going forward, we will have surplus capacity. So therefore, but of course, the cost of health service is not as low as in Egypt. We have to manage the finances extremely well. But for Egypt, I don't think it's the biggest challenge. It's very doable. To me, it's very doable. So, but the physical infrastructure, the hospital infrastructure, and integrating with the modern system, with the centralized system of universal health insurance, is a work task that has to be done in Egypt. That's very important. Yesterday, the Minister of Health and Population of Egypt, His Excellency Deputy Prime Minister, is in Turkey. And I'm sure that his observations, his interaction with our hospitals, with our health management authorities, prepares the ground for further cooperation between us. We already signed an agreement during the visit of His Excellency the President Sisi in September 2024 in health cooperation. And next month, our Minister of Health will be coming to Egypt on a bilateral visit, and then we will sit down and then see in what way we can exchange experience, and then the Turkish model, Turkish experience and mistakes that we do, the successes that we have achieved can be used as a lessons learned by Egyptian authorities. As I said, in Turkey, since 2003, we have almost completed the health reform. In 2003, we have started health transformation system in Turkey, meaning that we have changed the whole system, and then we have gathered together under a single umbrella all the health and social protection agencies as a social security agency. And then we have also made all types of hospitals, like social insurance hospitals or other public hospitals, under the Ministry of Health. So that was a very difficult feat to achieve. And we have also adopted a policy of patient-centered services. So therefore, it's a very unique model. We added to that is the 20 city hospitals that we have built in the last 5 years. That is a large collection of hospitals, campuses of hospitals, say cardiology, oncology, maternity, a general hospital, orthopedic hospital, under one campus.
Yeah.
One of the largest hospitals are in Istanbul, Ankara, and Izmir, with a capacity of 5,000 beds each.
It's like medical city.
It's a medical city.
Yeah.
It's a medical
It's a
city.
mega medical city.
Yes, we call it city hospital, but it's a medical city. They work fine, very well. I mean, there are efficiencies and productivities that we benefit from the existence of these city hospitals or medical cities. We have 2 medical cities in Ankara. So these are the achievements that we can record, and I think there is little left to be done, but to enhance the quality further. We want to, of course, also share our experience in a public-private partnership because we have built most of these city hospitals, medical cities, under this program. So therefore, it can be a good example, and then we are ready to share all our experiences, all what we have learned, or our mistakes. So that is very important to share.
Your Excellency, regarding this point of public-private partnership, as we are going to the second phase, as you saw today, and we need more investment, and we need, regarding to your words about the physical infrastructure, so we need more financing for the system, and we need more financing and more investment. And as we know that Turkey has a good models in the private-public partnership. So how do you see the opportunity for the Turkish private sector to enter the Egyptian market?
I think that with the right pricing model, they will be open. It's all about pricing. So either you make the patients pay or you make the government pay in a certain period of time. And the private sector, with their experience, would be interested if they see profit. So they will be very interested if the pricing model works out for them. In some of the hospitals, city hospitals or medical cities, we also use IDB financing, Islamic Development Bank financing, so some international financing also. So, but majority of the medical cities, yes, we have used PPP. And it all depends on the pricing and the agreement with the government. I think that it's worthwhile.
I think we are going in the good way, as we have now many methodology for pricing, for the fair pricings, for multiple payment methods. So it's a call from us to the Turkish private sector to be with us here in Egypt and join us in this healthcare reform.
Definitely. I think that an Egypt Healthcare Authority can organize meetings with those companies who built the medical cities on this model, and then explore whether in terms of profitability and then feasibility, they can also enter the Egyptian market. I think it's very possible to do.
Great. Turkey has a great example about the medical tourism. And I am personally so fascinating about the medical tourism and how Turkey became a hub for the medical tourism for the Middle East and the region. So if we need to learn more from the experience from Turkey, as we have a program initiative here in Egypt Healthcare Authority, under name is in Egypt We Care. So what do you recommend for us to follow these steps for
Definitely, and we will be very pleased to share our experience. I think that as compared to Europe, our cost for services to, say, an Irish person who's under the government or private insurance, or a German person who needs standard procedures. So what it costs in Turkey is like fraction of what it would cost in the UK, Ireland, or Sweden. Not only hair transplant, but many other procedures. And then the waiting time is there like 3 months. In Turkey, they can do it next week. So it makes sense for European patients especially, but also Iranis or Iraqis to come to Turkey and do their standard procedures. There are like maybe 100 standard procedures that they can do in Turkey. For Egypt, so this is an advantage of Turkey for our neighborhood and for Europeans. So therefore, I think Egypt can learn from us, and then we can share our experience with Egypt. And Egypt can also find its edge in its own neighborhood, and then target. What should be the target? To me, as an outsider, but insider also, African market is the best target for Egypt.
And we are the entrance for Africa.
Yeah. Definitely. The best prices in the region, and accessibility. Accessibility is important. Great hotel infrastructure, great connectivity with airplanes. So first, let's target, let's determine our target, the target of Egypt. For me, the neighborhood, especially Africa, the best. So therefore, the prices are great. Egyptian doctors, I have to say, for example, When I have a small problems, my son has small problems, I always consult Egyptian doctors and the Turkish doctors, both, on telephone. And all the time, when I speak with the Turkish doctors, they say, we always meet with our Egyptian colleagues in the international congresses, and they are as good as us.
Right.
The eye or heart or internal medicine. So therefore, Egyptian doctors are great. So for the neighborhood, for Africa, private hospitals, as well as many of the public hospitals, offer great infrastructure. And then once this organization is complete, as in terms of bringing them over here through, of course, travel agencies specialized in this field, through private or special access for them to the hospitals, because they will have language barrier, they will want to expect some certain different procedures of access. I think it will be a great program for Egypt to target North Africa and especially Africa as a whole.
Thank you, Your Excellency, about your great insights. So before we conclude, we need to conclude from you with a message for the Egypt Healthcare Authority.
I think that the Egypt Healthcare Authority is managed by great, bright leaders like yourself, like Dr. Ahmed Subki. You are all my friends, and I appreciate all what you have been doing. And you are one of the greatest institutions in Egypt. I really, really appreciate. And I'm sure that you will be accomplishing your task fully in the medium term.
Thank you, Your Excellency, for your invaluable insights and being with us today.
Thank you very much for hosting me.
Thank you.